Welcome back, my people. We are still on our topic whereby we are discussing about cones. So before we continue, for those who have not subscribed, you are there looking at this video and you know you have not subscribed, you are just but dragging us back. Your subscription is very important in this channel. So let's subscribe, encourage our brothers and sisters to subscribe. Let's share the videos, let's like, let's comment, and make sure they reach the whole world. And I do appreciate for those who have subscribed. We are almost at 8,000 subscribers, and I don't take it for granted. Thank you for your support, and let's keep the support on. Let's get back to our point of discussion, whereby in this video we will be discussing the diagnosis, or how can you diagnose a patient is having a cone or a callus, and also the treatment. So in diagnosis, through one, physical examination, which helps to rule out other causes of thickened skin, for example, warts and cysts. Note this: your healthcare provider or doctor provides all, make sure, all might confirm the diagnosis of a wart or a cone by pairing a bit of hardened skin, or by peeling a bit of hardened skin. If it bleeds or reveals a black points or dried blood, it's a wart, not a cone or callus. Let's repeat this point. In diagnosis, physical examination helps to rule out other causes of thickened skin, for example, warts and cysts. Note this: your healthcare provider might confirm, your healthcare provider or your doctor might confirm the diagnosis by peeling a bit of the hardened skin. If it bleeds or reveals black points of blood or dried blood, it's a wart, not a cone. Let's get to the treatment. Treatment for cones and calluses is the same because both resemble each other. So the treatment modalities used are the same and involve avoiding the repetitive actions that cause them to form. For example, avoiding or wearing well-fitting shoes and using protective pads helps in protecting this kind of a disease. Let me repeat this point. In treatment for cones and calluses are the same because both resemble each other, and treatment involves avoiding the repetitive actions that cause them to form. For example, wearing a well-fitting shoe or avoiding a tight-fitting shoe, and also using protective pads helps to prevent cones and calluses. Next point: if cone or calluses persists, or becomes painful despite your self-care efforts, they might persist or become painful despite your self-care efforts. Medical treatments provide relief. For example, number one, trimming or cutting away excess skin. Your doctor can trim down the thickened skin with a scalpel. And a point to note, don't try this yourself as it might cause an infection. Don't try trimming the callus or the cone yourself. It should be done by a doctor or a healthcare provider, as you yourself, you might cause an infection to yourself. Number 2, medicated patches. Your doctor may also apply a patch containing 40% salicylic acid or a clear away. The doctor might also try thinning the thickened skin with pumice stone, or yourself, you might try thinning the hardened skin with pumice stone or nail file or emery board before applying a patch. I hope you get this. You may also try trimming, I'm repeating that point, trimming the thickened skin with pumice stone, nail file or emery board before applying a patch. Number 3, shoe inserts. Shoe inserts. If you have an underlying foot deformity, your healthcare provider may prescribe some padded shoes. Some padded shoe inserts or orthotics. Let me repeat this point. In shoe inserts, if you have an underlying foot deformity, your doctor or healthcare provider may prescribe a padded shoe inserts or orthotics to prevent recurring of cones or calluses. Number 4, we have what we call surgery. Your doctor may suggest surgery to correct the alignment of a bone causing friction. You might have had an accident, maybe, let's say for example this finger. I might have had an accident and the bone might have bent or might have been disaligned, and this may cause the friction, maybe for example between the toe and the shoe. So surgery to correct this bone to become straight will help in relieving the pressure and friction between maybe your toe and your shoe, and this helps in removing or preventing occurrence of cones or calluses. Another point we are going to discuss is about lifestyle and home remedies for cones and calluses. Lifestyles and home remedies for cones and calluses. 1, soak hands all feet. Soak hands all feet. Soaking in warm water softens them. Soaking in warm water softens the cone or calluses and makes it easier to remove. Number 2, thickened skin. Thin, thickened skin. So, after soaking, rub the cone or callus with nail file, which removes the layer of the toughened skin. After soaking the affected area in warm water, it becomes soft. So, if you rub the area with a nail file, it removes the layer of the toughened skin. Number 3, use cone pads. Use cone pads. Here, you apply a donut-shaped foam pad to prevent the area where cone forms. You apply a donut-shaped foam pad to protect the area whereby the cone or the callus forms. Number 4, moisturize skin. Use moisturizer on hands and feet regularly. This makes the part soft and avoids occurring of the cones. The last point, wear comfortable shoes and socks. Wear comfortable shoes, all well-fitting shoes and socks, and these will help in avoiding occurrence of cones and calluses. This marks the end of our topic about cones and calluses, and thank you for your time. Thank you for being with me, and let's meet in the next video whereby we'll be discussing another condition. So guys, keep the support on, continue subscribing, liking and sharing our videos so that they may reach as many people as possible. Have a wonderful evening.